I've never met you, but I want to ask you something before we even begin. Have you looked at your feet today? Really looked at them? Not just glanced down while putting on your socks, but actually looked at the skin, the color, the little details most of us walk past every single day without a second thought. Because here's the truth I want you to sit with for a moment. Your feet can quietly tell you a story about what's happening inside your body long before any other part of you does. And sometimes that story is about something as serious as diabetes. I'm not here to scare you. I'm here because I care about you actually seeing tomorrow with more energy, more clarity, and more control over your health than you have today. Millions of people are walking around with blood sugar problems and they don't know it yet. Not because they're careless, but because nobody ever taught them what to look for. Today, that changes. By the end of this video, you're going to know 7 warning signs your feet might be showing you right now. Signs that are often the earliest whispers of diabetes, long before a blood test ever confirms it. So let me ask you this, and I really want you to think about it, then drop your answer in the comments below. When was the last time you checked your feet for changes? Was it today, last week, or honestly can't even remember? I want you to comment right now because I promise you, by the time this video ends, checking your feet is going to become one of the simplest and most powerful health habits you carry with you for the rest of your life. Let's start with something so many people brush off as just dry skin. Sign number one is unusual dryness or cracking, especially around the heels. Now, dry skin happens to everyone, especially as we get older, and I'm not telling you that cracked heels automatically mean diabetes. But here's what I want you to understand. When blood sugar stays elevated for a long time, it can damage the nerves that control sweat and oil production in your feet. Those nerves are responsible for keeping your skin moist and supple. When they stop working properly, your skin can become unusually dry, flaky, or even crack in ways that don't heal the way they used to. If you've noticed your feet feeling like sandpaper no matter how much lotion you use, that's worth paying attention to. It's your body raising its hand and saying, something's different here. Sign number two, and this one is incredibly important, numbness or tingling in your toes and feet. Have you ever had that pins and needles feeling, like your foot fell asleep, but it doesn't fully wake up the way it should? Or maybe you've noticed you can't feel the texture of your carpet under your bare feet the way you used to? This is one of the most common early signs of nerve damage related to blood sugar, and doctors call it peripheral neuropathy. Here's why this matters so much. When high blood sugar circulates through your body for months or years without being addressed, it slowly damages the small nerves in the farthest parts of your body, starting with your feet. That numbness isn't your imagination, and it isn't something to just get used to. I want you to take it seriously because the sooner it's addressed, the more that nerve function can potentially be protected. Now, let's talk about sign number three, a burning or tingling sensation, especially at night. This one catches a lot of people off guard because it can feel almost the opposite of numbness. Instead of losing feeling, some people describe it as their feet feeling like they're on fire or like there are tiny electric shocks running through their toes, particularly when they're lying in bed trying to sleep. If you've ever kicked the blanket off because your feet felt like they were burning up, even though the room was cool, please don't ignore that. This burning sensation is often connected to the same nerve irritation caused by consistently high blood sugar levels. It's uncomfortable, it's exhausting, and it deserves to be checked out, not just tolerated. Let's move to sign number four, wounds, cuts, or blisters that are slow to heal. I want you to really picture this. You get a small cut on your foot, maybe from a rock in your shoe or a blister from a new pair of sneakers. Normally, that would heal up in a week or two, right? But if you've noticed cuts and sores on your feet lingering for weeks, staying open, getting worse instead of better, that is one of the clearest signals your body can give you. High blood sugar affects circulation, meaning less oxygen and fewer nutrients reach the tissue that needs to repair itself. It also weakens your immune system's ability to fight off infection in that area. This is why foot wounds in people with unmanaged blood sugar can become so serious if left unaddressed, because the body simply isn't healing itself the way it should. If you have any wound on your foot that isn't improving, please don't wait. See a doctor. This is one of those signs where time truly matters. Sign number 5 is changes in the color or temperature of your feet. Take a moment sometime today and look at your feet next to each other. Are they both the same color? Do they both feel the same temperature? When blood flow to your feet becomes restricted, something that can happen with long term high blood sugar, you might notice your feet looking unusually pale, reddish, or even a bit bluish in tone. You might also notice one foot feels colder than the other or colder than it should compared to the rest of your body. This happens because the small blood vessels that feed your feet can become narrowed or damaged over time, reducing the blood flow that keeps your skin looking healthy and feeling warm. It's subtle and it's easy to miss if you're not looking for it, which is exactly why I wanted to bring it to your attention today. Now, here's sign number 6, and this is one that even doctors say gets overlooked far too often: swelling in your feet or ankles. Occasional swelling after a long day on your feet or after a salty meal, that's normal for a lot of people. But I'm talking about swelling that seems to show up without a clear reason, that doesn't go away with rest, or that seems to be getting a little more noticeable over time. This kind of swelling can be connected to how elevated blood sugar affects your circulation and the tiny blood vessels in your lower legs and feet. It can also be tied to kidney function, since your kidneys and blood sugar levels are deeply connected. If your socks are leaving deeper marks on your ankles than they used to, or your shoes are feeling tighter by the end of the day for no obvious reason, that's your body asking you to pay closer attention. And finally, sign number 7: a change in the shape of your foot or unusual pressure points when you walk. This is one people rarely connect to blood sugar, but it's incredibly real. Long term nerve damage and changes in circulation can, over time, affect the structure of your foot. You might notice your arch looking different or new calluses forming in spots where they never used to be, simply because the way you distribute weight when you walk has changed without you realizing it. Some people notice their toes curling slightly differently or their foot feeling like it doesn't quite sit the same way in their shoes anymore. These changes tend to happen gradually, which is exactly why they're so easy to miss, but your feet are trying to tell you something is shifting internally. Now, I want to pause here and be really clear with you because this matters. None of these 7 signs on their own confirm that you have diabetes. Only a proper medical test, a simple blood sugar or A1C test done by a healthcare provider can actually tell you that. What I want you to take away from this video isn't fear, it's awareness. I want you to become someone who pays attention to your body instead of ignoring it. So many people wait until symptoms become impossible to ignore, when catching things early gives you so much more power over your own health story. If any of these 7 signs sound familiar to you, the dryness, the numbness, the burning, the slow healing, the color changes, the swelling, or the shifting shape of your foot, please make an appointment with your doctor. Not because I want to alarm you, but because knowledge early on is one of the greatest gifts you can give yourself. Diabetes, when caught early, can be managed remarkably well with the right guidance, the right lifestyle changes, and the right support from medical professionals. You are not powerless in this, not even close. I also want to give you a few simple things you can start doing today, regardless of what you find when you check your feet. First, make foot checks a daily habit. It takes less than a minute. Look at the tops, the bottoms, between your toes. Get to know what normal looks like for you so you notice quickly if something changes. Second, keep your feet moisturized, but avoid putting lotion directly between your toes, since too much moisture there can actually encourage fungal issues. Third, wear well fitting shoes that don't rub or pinch, because friction and pressure points are exactly what can turn into problems if your circulation or nerve sensation isn't at its best. Fourth, if you smoke, please know that smoking significantly worsens circulation, especially in the smallest blood vessels in your feet. Cutting back or quitting altogether can make a meaningful difference. And fifth, stay active. Movement, even simple daily walking, supports healthy circulation throughout your entire body, feet included. I also want to speak directly to those of you watching this who already know you have blood sugar concerns, whether that's prediabetes or diabetes itself. I see you and I want you to know that checking your feet daily isn't paranoia, it's self respect. It's you saying, I deserve to catch small problems while they're still small. Doctors who specialize in this often say that many of the most serious foot complications connected to diabetes are preventable when caught early. That single sentence should give you hope, not fear. You have more influence over this outcome than you might realize. And to those of you who don't have diabetes but maybe have a family history or maybe just want to protect your long term health, this video is for you too. Prevention is always more powerful than treatment. The habits I just shared with you cost nothing but a little consistency, and consistency is something every single one of us is capable of. Before you go, I want you to do one thing for me. Take off your socks right now, or as soon as this video ends, and actually look at your feet with fresh eyes. Check for the things we talked about today. And then come back to the comments and tell me honestly, did you notice anything you hadn't paid attention to before? I read every comment and I want to know how this landed with you because your health story matters to me and I want to walk through it with you, one honest conversation at a time. If this video helped you see your body a little differently today, do me a favor and share it with someone you love, a parent, a grandparent, a friend who's always on their feet all day. You might be the reason someone catches something early instead of too late. And if you want more videos like this, ones that give you real, practical, empowering health information without the fear mongering and without the fluff, make sure you're subscribed because I've got so much more to share with you. Take care of those feet of yours. They've carried you your whole life. It's time you start listening to what they're trying to tell you. I'll see you in the next video.